welcome to Population Health Plug-in, a show highlighting current issues surrounding our community and topics of interest for the students across the university. My name is Anna Layton, and today we have with us Dr. Susan Wally. Dr. Wally is an associate professor at UAB and is a pediatric hospitalist at Children's of Alabama. Thank you for being here with us today, Dr. Wally.
Thank you for having me, Anna.
We're so glad that you could take time out of your schedule to speak with us about the impacts of electronic cigarettes and vaping and their impacts on public health. So, Dr. Wally, can you tell us some of the reasons why electronic cigarettes and vaping have gained so much popularity in the past few years among teens and adults?
What we've seen over the past few years is this astronomical increase in the rates of e-cigarette, also known as vape, use among youth and young adults, to the point that we're seeing in some studies, up to 40% youth use among high school students. Some national data from 2016 says that about 11% of high school students are currently using e-cigarettes, which means that they're using it in the past 30 days. And some of the reasons for that are very similar to reasons that we traditionally see adults and youth use tobacco products, which is marketing and advertising. So there's a lot of marketing and advertising directed to youth that make it seem cool, safe, and what I want to make sure to tell our youth and your listeners is that it's not a safe product, particularly when we're thinking about nicotine addiction and potentially having a whole new generation of children and young adults that are addicted to nicotine and tobacco products.
Can you tell us some of the health risks that are involved using e-cigarettes and vaping? And can you tell us if they're less dangerous than traditional tobacco products?
Well, I think oftentimes when we talk about e-cigarettes and the potential risks, we have to understand that, the research on conventional, traditional cigarettes took decades to really compile. And we know that tobacco is one of the most harmful legal products that kills 1 in every 3 cigarette smokers. And so, when we look at e-cigarettes and the things that are in them, we do know that they have potentially lower levels of toxicants and carcinogens and nicotine, but that doesn't mean that it's safe. And so I want to definitely stress that it may not be as harmful as cigarettes, but the more important thing is to know that they're harmful in themselves.
Can you tell us about maybe some of the health risks involved with secondhand smoke and how that may impact children that are particularly would be more vulnerable?
Right, and as a pediatrician, that really is an area that I'm very concerned about. That secondhand vapor, again, we don't know as much about it as we know about secondhand aerosol with, traditional cigarettes. But the concern is that we know that it contains, things that are harmful to health, like the nicotine, like carcinogens, things that cause cancer. We don't know yet. We don't have enough information to say that e-cigarette aerosol causes cancer. We don't have that cause and effect, but we know that some of the things that are found in the e-cigarette aerosol do cause cancer. So that's where we're really concerned that, children have no voice and they have no choice. And so if somebody's smoking or vaping an e-cigarette around them, the majority of the time they can't just say, well, I'm going to move to another house or I'm going to go somewhere else. So I want to make sure to advocate for them. And part of the way to do that is to make sure in our comprehensive smoke-free laws that they include e-cigarettes.
So what are some of the current trends for electronic cigarette and vape use as we see today, particularly among adults and teens?
Well, what we're seeing among adults is that oftentimes adults who might be using e-cigarettes in order to cut down or stop smoking, they end up being what we call dual users, where they're using both cigarettes, and they may have cut down, but they're also using e-cigarettes. And oftentimes they may be using the e-cigarette in places that they couldn't use a traditional cigarette, which is of really big concern, because if somebody wants to quit, we want to support that effort, but we don't want them to be using a product that continues their nicotine addiction and possibly decreases their likelihood of quitting.
What do you see as the long-term impact for electronic cigarettes for public health?
Well, I think that there was a recent National Academy of Science report that really was looking at it from a public health standpoint. And as a pediatrician and somebody who, unfortunately sees the impact of tobacco use on a daily basis, when I'm seeing children who are hospitalized with asthma and very well-meaning parents who smoke, but that smoke exposure makes their child's asthma worse, I really have to be very concerned about the potential for e-cigarettes on public health, particularly when we know that youth that use e-cigarettes, when we look at them a year later, they're more likely to use traditional cigarettes. So we really want to protect our youth from even starting a habit that could lead to traditional cigarette use.
So who regulates electronic cigarettes? Are there any policies or regulations recently that have come out that have attempted to reduce electronic cigarette use among teens?
That's a really good question. So the Food and Drug Administration, the FDA, has the authority over tobacco products. And as of August of 2016, they basically deemed the authority over electronic cigarettes, as well as some other tobacco products like cigars and cigarillos. The intention was for some of these regulations to clearly be implemented over time. Currently, some of the regulations are in suspension, with full implementation not till November of 2022. And so we're still in a period where there is concern that products that have advertised, certain ingredients, they may not, be regulated to the point where the consumer knows exactly what they're getting. Some of the other regulations that some communities on a local level have implemented are things like banning flavors, because some of the flavors that are found in e-cigarettes are things that are very, very child appealing, like sour Skittles, gummy bear, things that kids love. And that was why flavors have been banned from traditional cigarettes, other than menthol, for decades, because we knew that it encouraged youth to smoke. And so, for your listeners, we want to really focus on some of those public health initiatives, like comprehensive smoke-free policies that include electronic cigarettes, and then other things that include increasing the age of purchase of tobacco products to 21 years of age. Other things like restricting flavors. And some communities, like for example in San Francisco, have made it that flavors, tobacco flavors, including menthol, are not legally sold in that community.
So what are some ways that we can help spread awareness about these issues?
Well, exactly what you're doing now. And, certainly as, your listeners are interested in public health, I think, not only on an individual level, reaching out to people that your friends and your loved ones who may not have all the information, but also, going to, communities and being an advocate and letting people know that, e-cigarettes, particularly for youth, are not safe.
Well, Dr. Wally, thank you so much for being here and for giving us more information about the impacts on electronic cigarettes and vaping.
Well, thank you,
It was really
Anna.
a pleasure to have you.
Thank you.
And thank you for watching. And please tune in next time for another episode of Population Health Plugin.